The mulatiram. Then, it reaches the upper region of the hip by cataracal marrow, scissoring, in the mulatiram and proceeds towards the kidneys. From there it flows upwards to Navarmum and energizes it and then proceeds further to Visuddhi and runs towards the left cevicatriculum to reach Padari where it gets replenished. Then along with Padari energy it reaches the left ear and proceeds further and spreads in the inner region of the brain. One of the branches terminates at the tip of the left nostril and the other branch halts at Kandikali. This nadi is capable of flowing from bottom to top and vice versa. The following symptoms occur due to the damage in the flow of the Idakala Na with Macron, diseases caused due to damage of Ayakala Na with Macron. Loss of body weight. Muscle wasting. Diseases related to Vata. Pain throughout the body, chronic headache. Continuous belching and hiccups. Drumming of the ears / tinnitus, constipation and anuria. Hip-related problems, malfunctioning of the tongue. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Idakala Na with Macron has to be rectified by rendering the following treatment. Rectifying the functioning of Idakala Na with Macron. The 3 Varmam points in the big toe have to be properly stimulated. Ulamkalveli tapping. Manai stimulation. Kambari Kalam rotation. Kumbhakamudaku tapping, Kaladi stimulation. Mundel Varmam stimulation. Padari rotation. Sevikutri stimulation. Kandikali stimulation. The above-mentioned stimulations rectify the damages in the flow of the Idakala nadi, thereby enhancing the air element in the body followed by enhancing the earth element, which thus enriches the well-being of the body. Pingalai Na with Macron. This nadi originates at the left big toe and branches into 3 at Ulamkalveli and reaches cuticle where one of the branches terminates. The remaining 2 branches flow and spread at the sole of the foot. From there, one branch proceeds upward through the canucle, ankle joint, to reach Manai, Kambari, Kulmo, Ultadai and makes 3 rotations at Amai Kalam. Then, it flows upwards through Kultarai, Mulatiram and the energy center of Kathirikal Maral and reaches the intestine and energizes it. It moves further up passing through the chest and neck and reaches the inside of the right ear, then circles the Kapala, scalp, energizes the Nakatraklum and terminates at the tip of the right nostril. The following symptoms occur due to the damage in the flow of the Pingalai Na with Macron. Diseases caused due to damage of Pingalai Na with Macron. Increase in body temperature, burning sensation in the eyes and eye-related problems. Stomach-related diseases, peptic ulcers, indigestion, diabetes, hypertension, headache, problems related to the reproductive organs, mind-related stress. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Pingalai Na with Macron has to be rectified by rendering the following treatment. Rectifying the functioning of Pingalai Na with Macron, the 3 Varmam points in the big toe have to be properly stimulated. Mutta Varmam stimulation, Amai Kalam stimulation, Anakalam tapping, Adipam tapping, Navarmam rotation and lifting, Surankali stimulation. Talapai Kalam Nakatraklam. Kundi Kalam. The above-mentioned stimulations rectify the damages in the flow of the Pingalai Na with Macron. Singhavai Na with diuresis. This Na with Macron originates and divides into 8 at the Mulatiram. It moves upward and merges with the Pingalai and Idakala Na with Macron and reaches the navel where it branches into 10. This Na with Macron circles the intestine, enters the liver and reaches Appam where it divides into 6 branches. It enters the lungs and reaches Sevikutri via Visuddhi and continues to the throat and terminates at uvula and both the brims of the tongue. At uvula, this Na with tilde merges with the Susumna Na with Macron. The following symptoms occur due to the damage in the flow of the Singhavai Na with Macron. Diseases caused due to damage of Singhavai Na with Macron. Tongue-related problems. Ear-related problems. Salivary gland-related problems. Blood-related diseases. Lung-related diseases. Pain and weakness in the hip joint. Throat-related problems. Pain in the Ani Kalam, coccygeal pain, urinary tract-related problems, gastric problems, etc. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Singhavai ene with macron has to be rectified by rendering the following treatment. Rectifying the functioning of Singhavai ene with macron. Kultari stimulation, ulcitrum stimulation, Anakalam meltari lifting, Adipakalam tapping, Vilang stimulation, Sakti varmam, Krayal varmam, Mundal siranaram, head massage, Pidarikalam. The above-mentioned stimulations rectify the damage in the flow of the Singhavai nadi. The tip of the branches of Singhavai ene with macron ends in different places. They are uvula, base of the tongue, Anakalam meltari, and Tusamukha, Tusamugha, varmam. Alamburuan ene with macron. This nadi originates at the cuticle. It rotates thrice at the calmani and reaches the thigh where it divides into 4 branches. It passes around the hip in the form of an arananam, hip chain. It then flows below the umbilicus and along with the uri naram reaches the gallbladder. From there, it moves upwards through adipam to reach the base of the shoulder. It then passes through tumakalam where it divides into 2 branches and enters the neck and flows up towards sevikutri, akiranam, and spreads in the forehead, halting at Anand Kalam. It finally terminates at the right eye. The following symptoms occur due to the damage in the flow of the Alamburudan nadi. Diseases caused due to damage of Alamburuan ene with macron. Neck pain, leg pain, hip pain, varicose veins, lower abdomen related problems, indigestion, bone joint related problems, headache, gallbladder related problems. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Alamburuan ene with macron has to be rectified by rendering the following treatment. Rectifying the functioning of Alamburuan ene with macron, cuticle varmam stimulation, melmanai stimulation, Arayapus stimulation, Nangapta stimulation, Kaladaikalam stimulation, Pala varmam stimulation, Kumbhakamuyaku stimulation, Saramudiku stimulation, Pidari rotation, Alavukaku stimulation. The above-mentioned stimulations rectify the damages in the flow of the Alamburudan ene with macron. Gandhari ene with macron. This ene with macron originates from the left naxatraculum. From there, it enters the base of the ear and reaches Pidari where it divides into 8 branches. One of the branches passes through Visuddhi and reaches the gallbladder. From the gallbladder it reaches Nattel and further divides into 4 branches. One of the branches merges with Nadu Nadi, Susumna, and descends through the spine and circles at Nangapu. From there, it descends further along with Ayakala and terminates at cuticle. The following symptoms occur due to the damage in the flow of the Gandhari Nadi. Diseases caused due to damage of Gandhari ene with macron. Weakness of the upper and lower limbs. Hip pain. Fatigue. Giddiness. Vertigo. Decrease in the level of blood components, improper functioning of the bone marrow. Shoulder pain. Neck pain. Calf muscle related problems. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Gandhari ene with macron has to be rectified by rendering the following treatment. Rectifying the functioning of Gandhari nadi. Cuticle varmam, right, stimulation, Kambari Kalam stimulation. Nangapu stimulation, Adipam stimulation. Asti Kantari stimulation. Piratari stimulation. Kakatai massage. Pidari stimulation. Sevikatriculum stimulation. Nakatraculum stimulation. The Gandhari ene with macron also branches into both the hands. Asani ene with macron. This nadi originates from inside the kundalini. It ascends to the navel and surrounds it where it divides into 206 branches. One of the branches moves along the large intestine, enters the stomach and flows through the base of the stomach into the liver and gallbladder. It makes 12 rotations at the gallbladder. From the throat it ascends to uvula. From here it reaches the right ear internally and it divides into 12 branches at the right ear. Again it enters Pankavarai Rupu, soft palate, and passes through the upper part of uvula, back of the throat and spreads at Padari Vattam. From there, along with Nadu and with Makron, Susumna, it reaches Kundalini where it merges with Gandhari. Na with Makron and again ascends to terminate at the right ear. The following symptoms occur due to the damage in the flow of the Asani Na with Makron. Diseases caused due to damage of Asani Na with Makron. Gastric problems. Indigestion. Large intestine-related problems. Gallbladder-related problems. Mouth ulcers. Ear-related problems. Pain in the occipital region. Backache. Giddiness. Weakness in the legs. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Asani Na with Makron has to be rectified by rendering the following treatment. Rectifying the functioning of Asani Na with Makron, Varalumban Poigai stimulation Anakalam clenching. Palavarmam stimulation Adipam, right, stimulation Vilang, right, stimulation Garuda Varmam stimulation Sakti Varmam stimulation Sara Muiku clenching Sevikutri stimulation. Kandakali stimulation. Asani Nadi is the longest Na with Makron. Karu Na with Makron. This Na with Makron originates at the lower end of the vertebral column and splits into 4 branches at the Kundalini. One of the branches travels along the lower and upper sides of the urinary bladder and reaches the base of Mundell. Then along with Analkali, Pingali, it ascends through Nattel to reach the sternum where it divides into 200 branches. From there, it ascends through the front of the neck and reaches Padari. Again it moves upwards towards the vertex and from Ithir it reaches uvula. From uvula it reaches the forehead. At the forehead it merges with Susumna Nadi and terminates at the upper end of the vertebral column, Karumtam Udiku. The following symptoms occur due to the damage in the flow of the Karu Na with Makron. Diseases caused due to damage of Karu Na with Makron. Urinary problems. Constipation. Problems in the lungs. Hiccups. Increase in the body temperature. Heart-related problems. Problems related to vision. Pain in the spine. Pricking sensation at the vertex. Unusual pain in the lower abdomen. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Karu Na with Makron has to be rectified by rendering the following treatment. Rectifying the functioning of Karu Na with Makron, Ani Kalam stimulation. Anda Kalam stimulation. Kaladaikalam stimulation Surya Astasaruki stimulation Mundell Varmam stimulation. Nattel rotation. Kumbu tapping Sangutiri stimulation. Kandikali stimulation Paksanmam stimulation Kundi Kalam stimulation. This Karu Na with Makron flows in a manner so as to pass through the upper and lower ends of the spine. Sanguni Na with Makron. This Na originates at the base of the penis and functions along with Ayakala and Pingali. It ascends through the urinary bladder, navel, liver, lungs, stomach and reaches the heart. It divides into 8 branches each at the apex and at the base of the heart, thereby energizing it. One of the branches ascends to Tumakalam and spreads its energy at Visuddhi. From there, it passes through Sangutiri, Sevikutri, and Padari. At Padari it divides into 36 branches. Each of the branches further divides into 16, i.e., 36 times 16 is equal to 576, and all these spread all over the head. This is also referred to as a dissociation Na with Makron. The following symptoms occur due to the damage in the flow of the Sanguni Na with Makron. Diseases caused due to damage of Sanguni Na with Makron. Problems related to reproductive organs. Problems related to urine discharge. Indigestion. Food pipe-related problems. Windpipe-related problems. Lung-related problems. Cough. Breathlessness. Problems related to salivary secretions. Numbness. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Sangyuni Na with Macron has to be rectified by rendering the following treatment. Rectifying the functioning of Sangyuni Na with Macron, Nangapu stimulation. Pearl tapping. Kaliakalam lifting. Anakalam stimulation. Garuda Varmam, left, stimulation. Vital Varmam stimulation. Sangyatiri Varmam stimulation. Pidari stimulation. Pinkandi stimulation. Kunbu Kalam stimulation. This Na with Macron originates at the reproductive organs of the male and female as its basis. Atini Na with Macron. This Na with Macron originates at the Muladaram and reaches the base of the Kundalini. From there, it ascends through the Mayor Polyvasal, enters into the vertebral column and reaches the navel where it divides into 206 branches. One of the branches reaches Natel and moves upwards to Piarikalam and reaches the backside of the vertex. From there, it reaches the forehead where it divides into 84 branches. One of these branches terminates behind the Amutta callosum, Amta callosum. The following symptoms occur due to the damage in the flow of the Atini Na with Macron. Diseases caused due to damage of Atini nadi. Weakness in the muscle structure. Loss of muscle tone in the rectum. Loose stools. Constipation in a few. Peptic ulcers. Backache spasms. Chronic headache. Pain in the occipital region, memory loss. Endocrine disorders. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Atini nadi has to be rectified by rendering the following treatment. Rectifying the functioning of Atini Na with Macron, Kumbhakamudiku stimulation. Ani Kalam stimulation. Anakalam stimulation, Natel rotation. Saramudiku rotation. Pitarikalam stimulation, Kandakali stimulation. Naduku Varmam stimulation. Paksinama Varmam stimulation. Vetrali Kalam stimulation. Pali nadi. This nadi originates at the Muladaram, energizes the reproductive organs and ascends to the intestines and terminates at the base of the Mundal. At Mundal it merges with both the Ayakal and Pingalai nadi and functions along with the brain. The following symptoms occur due to the damage in the flow of the Paali nadi. Diseases caused due to damage of Paali Na with Macron. Crouching of the body. Reproductive organs disorders. Stomach ache. Mental depression. Pain in the joints. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Paali nadi has to be rectified by rendering the following treatment. Rectifying the functioning of Paali, Kumbhakamudiku tapping, Jadapiral tapping. Kalkati Kalam stimulation. Kunambu Kalam. Pirateral. Kanadi Kalam. Visyalodaran Na with Macron. This nadi originates at the Muladaram and reaches Sukrasayam and Karpasayam, Garbhasayam, in the male and female bodies respectively. It merges with Idakala, Pingalal and Susumna Na with Macron and connects with the brain. The following symptoms occur due to the damage in the flow of the Visyalodaran Na with Macron. Diseases caused due to damage of Visyalodaran Na with Macron. Mental depression. Body tiredness. Reproductive disorders. Pain in the bone joints. Burning sensation in the sole of the foot. When the above-mentioned symptoms prevail in a person, the impediment in the functioning of the Visyalodaran nadi has to be rectified by rendering the following treatment. Rectifying the functioning of Visyalodaran Na with Macron. Kandakali stimulation. Kunambu Kalam stimulation. Vilang Varmam stimulation, Tivalal tapping. Ulcitram stimulation, Kumbhakamudiku tapping, Manai stimulation. Guran Patukal. Any damage caused in the functioning of the above-mentioned 12 nadi results in diseases. Each nadi has its own set of techniques to alleviate a disease. But, it is hard to identify as to which nadi is affected. To overcome this hardship, Guranadi Patukal has to be performed, thereby correcting the damages caused in the nadi. The art of Varmam expounds 32 such techniques. One such technique is elaborated below. To understand this, Kaimut Varmam. Patradankal lies 3 fingers above the Kaimut. Varmam. Mutadankal lies 3 fingers below the Kaimut Varmam on the forearm. Connecting these 3 Varmams is known as Guranadi Patukal, and it is to be learnt from a master. Method of application. Place the interphalangeal joint of the thumb, 1/4 matrai, on Mudha Varmam. Then drag the thumb from medial to lateral through Patradankal on the inner side, medial, of the elbow joint. Again, place the interphalangeal joint of the thumb, 1/4 matrai, on Mudha Varmam. Drag the placed thumb from medial to lateral via Mutadankal with a downward movement. Again with the 1/4 matrai of the thumb press Ma and make the Amartal Saibagam, movement. At Mudha Varmam. According to the philosophy of Siddhar, this method of Guran Patukal rectifies the damages caused in all the 12 Na with Makron. Concept of Amta and Visa Kala in the human body and its importance in Varmam treatment 34. Various concepts like Sara Onal, movement of Sara in body, Amtanalika. Level Amta in the body, Visanalika. Level of Visa in body, and strength of Mudiku are important while determining Varmam treatment. During Ksira Sagra Manthana, churning of Ksira Sagra, ocean of milk, Visa, poison, emerged on the 7th day, and Amta, nectar of immortality, emerged on the 8th day. It is believed that a portion from these 2 got settled in earth and a subtle portion got settled in human body. Visa destructs the body and Amta protects the body. The equilibrium between these 2 components maintains the health of human being. There is continuous circulation of Amta and Visa in human body. Visa starts to circulate on full moon day from the greater toe of one side, moves upwards and reach the center of head by the next full moon day. Again it descends downwards from the center of the head to the greater toe of other side by the next full moon day. Amta will stay in 28 different places in the human body on 28 days of a lunar month. In the human body, wherever Amta decreases in those places, Visa increases and causes disease. This is the basic concept of disease. Information courtesy Dr. Anupama K.J. Origin in Varmasastram. Techniques elaborating the stimulation of Amrita Nadi are mentioned in the chapter of various techniques. Concept of Sara 35. Sara travels through Ida Kala, Pingla, and Susumna Ene with Makron and reaches the Andasaya, organ of reproduction. Ayakala travels through right leg and Pingla travels through left leg, and both these Ene with Makron cross over at Aya. During crossing over of these 2 nadi a collision occurs and Susumna Ene with Makron originates from the spark of this collision. After crossing over, Ayakla goes to left side and the Pingla goes to right side of the body. Sumna travels through the midline of human body. The disease and health of the body depends on the way how these 3 climbs up. Amta is located in Susumna Ene with Makron, and Sara Om also takes place in Susumna Ene with Makron. Hence Susumna Ene with Makron determines the health of an individual. Sutrangal. Sutrangal are group of various Varmam techniques used in the correction of Sara, and also for treating various diseases. There are 26 types of Sutrangal mentioned in Varmam texts. Sara deals with the pathways of circulation of impulses through the Ayakala and Pingalai Ene with Makron. By assessing and learning the condition of these 2 Ene with Makron, the blockage in the pathways of Sara are identified and corrected. The Sara Om, or circulation of Sara, is assessed by the pattern of breathing. Any variation in breathing pattern will suggest abnormal Sara Om. Correction of Sara Om is done by appropriate Sara Sutrangal. Sutrangal incorporates many techniques which are used to activate Varmam points by various methods such as Tundal Miracle, which are used to stimulate a point by either twisting or tapping methods. Sara Sutrangal are usually done in early morning. There are various Sutrangal done to correct various diseases like Garbha Sutra. Garbha Sutra is a specific treatment method applicable for PCOD, infertility, gynecological disorders, etc. Another important sutra is Ghatakara Sutra. There are certain processes in the body that functions continuously like heartbeat and blood circulation. Kamala Nadi is related to heartbeat and blood circulation, which is a continuous process and comes under Ghatakara Sutra. The word Ghatakara means clock or manner are included under Ghatakara. If there is any disruption in this continuous process, Ghatakara, there are techniques, sutra, for its correction, and they are called as Ghatakara Sutra. Technique of doing Ghatakara Sutra is elaborated in the chapter named Various Techniques. Garbha Sutra. Initially, Sara Sutram is performed. Sara Sutram is meant to correct the Sara Atam in Ida Kala, Pingla, and Susumna Nadi. Sara Sutram is done for 30 minutes at early morning, and this corrects prana. Following Sara Sutram, Garbha Sutram is performed in the uterus. Before performing Garbha Sutram, pulsations at various areas of uterus are analyzed. There is a point called Nalmani, which is located at a ridge between the clitoris and vagina. The pulsations felt at this point helps in analyzing the health of the women. If a woman is unconscious, her consciousness can be regained by giving pressure at this point. Many diseases of woman can be assessed by examining the pulsations at Nalmani. Garbha Sutram is a highly specialized treatment protocol and has to be learned from a guru. Different nomenclatures of Varmam. 36 The energy of the body is generally referred to as Varmam. The Siddhar have referred to these places of abundant energy by various names. The list is as follows. Varmam, Kalam, Puravi, Yogam, Saram, Pranam, Svasam, Kale, Sivam Vasi. Apart from these, there are more than 40 different names by which energy is referred to in the Varmam. Texts. Varmam is a word that refers to a static energy. In a Varmam point, energy can be sensed irrespective of the time of the day, morning or evening. The point with such energy is called Varmam. Kalam is a point where the energy is in motion within that point. E.g. Tillard Hakalam is located at a depth of 36 Information Courtesy Drive North Shanmugam, reproduced from the book. Basic Concepts of Vethasathi Medical Varmalajikaibagam Saibagam, 2nd edition January 2019, published by Thirumolar Varmalogy Institute, Coimbatore. A measure of a paddy grain and finger measure in breadth. Within the finger breadth of Tillard Hakalam, a subtle Varmam energy is in constant motion, according to the Varmam texts. This Varmam energy which is capable of moving within the same point is termed as Kalam. The word Puravi means horse. In our body, there is an energy which is dynamic in motion like a horse. This energy is in constant motion from the toe to the head. Energy in the Varmam point is also termed as Yogam. Yogam means merging of one with the other. This function is accomplished only when the energy of a Varmam point works in synchronization with the energy of another Varmam point. The Varmam points that work in this manner are called Yogam. Saram is a word associated with respiration. When the air is exhaled after associating with the nerves of the brain, it is referred to as Saram. The Varmam points that are based in the region where the nerves emanate from the brain are called Saram. Prana is referred to as life or the life force energy. The functioning of life is prana. The Varmam points located in the lungs, the heart and the brain are classified as prana. Svasam is another name for Varmam and is located in the nasal passage. The word Kale means circulation or flow. The Varmam points that aid in the flow/circulation of blood, air and heat in the body are called Kale. Sivam is the Varmam that is related to the internal part of the brain. If the functioning of Sivam is destructed, the body ceases to function. Vasi means the dynamic and fine energetic air. The fundamental substance that one begets from one's parents is referred to as Vasi. This substantially supports the life functioning and boosts immunity in the body. It functions from all the Varmam points. For each inhalation, Vasi replenishes itself by absorbing 1/4 of the inhaled air. Hence, it is highlighted that all the points where Vasi touches are Varmam points. So, the word Varmam is referred to by different names based on their functions. The fundamental principles of Varmam functions are based on more than 40 such names and their meanings. For more details regarding this, refer the Tamil book called Varmam Sorpral Vilakam. Classification of Varmam 37. The Siddhar have named Varmam based on their methods of application. Information courtesy Drive N. Shanmugam, reproduced from the book Basic Concepts of Vethasathi Medical Varmalogikibhagam, Saibagam, 2nd edition January 2019, published by Thirumolar Varmalogy Institute, Coimbatore. Tadavarmam Pajavarmam. Tata Varmam Inai Varmam. Paka Varmam Eladai Varmam. Uta Varmam Naka Varmam. Nal Varmam Graha Varmam. Pachi Varmam Veda Varmam. Pitta Varmam Silatuma Varmam. Naka Varmam. There are several other Varmam classifications like the above mentioned, and their explanations can be referred in the Tamil book Varmam Sorpral Vilakam. Tavarmam and the Pajavarmam points will be dealt in detail. Tavarmam, Pavarmam. These two classifications, Tavarmam and Pajavarmam points, have to be stimulated using the fingers and palms. Tavarmam possesses less energy while the Pajavarmam possesses abundant energy. This is not an exhaustive explanation but serves for a simpler understanding. To comprehend better, Tadavarmam is a Varmam point that gets its name by the stimulation of it by touch. Whereas, when the application is done on a Varmam point and if it activates other point also, then that Varmam point is called as Pavarmam. Pavarmam -12. According to the Siddhar, the Pajavarmam points are 12 in number. Each Pajavarmam points is dependent on or located on a Na with tilde. The list below gives the Pajavarmam points and their related nadi. S.No Pajavarmam 1. Tilardhakalam Susumna nadi. 2. Naxatrakalam Pingalai nadi. 3. Pidarikalam. Idakala nadi. 4. Sevikutri kalam Singhavai nadi. 5. Urakakalam. Atini nadi. 6. Tumakalam Gandhari nadi. 7. Navarmam. Asani nadi. 8. Uramikalam. Karu nadi. 9. Adapakalam Alamburudan nadi. 10. Surya Astha Saruki Paali nadi. 11. Valiya Astha Saruki Visyalodaran Ene with diuresis. 12. Kaliakalam Sanguni nadi. The Pajavarmam points are situated in the important locations of above said nadi. The Tadavarmam points are located on the branches of the nadi. When the Pajavarmam is stimulated, the important location of the nadi is activated. The vibration of the activation spreads to its branches there by activating the Varmam points in the branches of the Na with tilde. So, as per the Varmam philosophy, when one Pajavarmam is activated, it activates 8 Tavarmam points. But, when a Tavarmam gets activated, the Pajavarmam points are not stimulated. Hence, it can be perceived that each Pajavarmam point has 8 corresponding Tavarmam points. Based on this, it is said that there are 12 Pavarmams and 96 Tavarmam. Tata Varmam. As per Varmam texts, there are 8 Tau Varmam points in the body. But, in the experience of the Asan, there are more than 20 Tau Varmam points. The Tata Varmam points are those which are stimulated by a gentle tap with the hands. E.g., tapping 5 times on the Tivalai Kalam, functions as the Panka Tawa Dankal. Inai Varmam. Inai Varmam is the functioning of 2 Varmam points in unison to cure a disease. The unified activation of the 2 points is called Inai Varmam. E.g., the Varmam points in the hand such as Ka and Kauli function in unison as Anai Varmam points to relieve pain in the hand. Paka Varmam. The Paka Varmam points refer to the points in the vicinity of a Varmam point. Each Varmam point will have a minimum of 2 Paka Varmam points and a maximum of 8 Paka Varmam points. E.g., there are 2 Varmam points close to the Kalakalam which are called Paka Varmam points of Kalakalam and they don't have a specific name. Eladai Kalam. Eladai Kalam refers to the Varmam points located in between bones. E.g., Manabanda Varmam is located between the bones. Likewise, the points with abundant energy like Sushi, Poigai are also located in the bone joints. Uta Varmam. Uta Varmam is the stimulation of certain Varmam points by blowing air, without touching by hands. Here, the air is blown by mouth on the Varmam point from a distance of 1/2 foot from the point. For this distance, one can use pipe to regulate air and using a paper pipe is ideal for the purpose. E.g. air can be blown on a point called Kandaikali and also on Tivalai Kalam using this method. Naku Varmam. Stimulating certain Varmam points by licking with the tongue are called Naku Varmam. It is instructed by Asen that Varmam stimulation should not be on newborns in the age group of 0 to 6 months. In those cases, Varmam stimulation can be done with the tongue. Nal Varmam. The Varmam points that are connected to the stars are Nal Varmam. The energy that emanates from the 27 stars, i.e. from Asvati to Revti, are connected with the 27 different organs of the body to strengthen the body and life. It is a natural phenomenon that every day a star moves closer to the moon. That particular star which is closest to the moon is the star of that day. The energy of that star is capable of activating certain Varmam points in the body. E.g., on the day of Revti star, energy flows to the heart. By placing the fingers over the heart, Tivalakalam, and by mildly pressing, it supplies wholesome energy to the heart. Even if this is not done, the energy naturally flows to the heart. There is a connection between each star and an organ in the body. Based on this, a 28 days treatment methodology was in practice, i.e. for treating a person born on a day with a Svati star, the patient has to be admitted a day prior, as an inpatient under an ASIN and initial treatment is rendered to him. Then, on the day of his birth star Asvati, the appropriate point in the body has to be stimulated with corresponding proper applications. For the next 27 days, the corresponding 27 Varmam points have to be stimulated. There are various application methods for the Varmam points connected with the 27 stars. It is prudential to master these before rendering treatment. This treatment will be completed in 28 days but is hardly prevalent nowadays. Graha Varmam. Graha Varmam points are associated with the 7 planets such as the Sun, Moon, Mars, Mercury, Jupiter, Venus and Saturn through their rays. The Sun is connected with bone-related Varmam points. The Moon is connected and functions with the blood-related Varmam points. Astrology states that Mars is related to blood, but the Graha Varmam states that the planet Mars is associated with the bone marrow. A thorough knowledge of these strengthens the Sapta Dhatu, 7 substances, of the body. Pachi Varmam. Pachi Varmam points are the ones related to the internal organs of the body and are 25 in number. With an in-depth study of these, one can comprehend the functioning time and the state of the internal organs. Veda Varmam. Veda Varmam points are the ones that regulate the quality of air in the body. An application, after proper learning, enhances the lifespan. The Vilang Varmam enhances the quantity of air in the body. Similarly, there are 64 Veda Varmam points and in each of these the quality of Veda will be in excess. Though this Veda quality is present in other Varmam points, it will be lesser in them. Pitta Varmam. Pitta Varmam points are the ones which regulate the heat in the body. These points are responsible for the growth of the body. As per Varmam texts, there are 38 Pitta Varmam points. Proper application of these points regulates the body temperature. Sila Tuma Varmam. Silatuma Varmam points regulate the blood flow and the phlegm in the body and are 6 in number. In all the Varmam points in the body, the presence of the Vata, Pitta and Silatuma components are present. The proportion of these components in a Varmam point depends on the needs of the body parts. Naku Varmam. Naku Varmam is a technique of stimulating the Varmam points using one's eyes. Naku Varmam can cure the diseases in the body. This technique can be used to attack a person and not for controlling the person's mind. The Varmam texts refer to 9 Naku Varmam points in total. Only men were rendering Varmam treatment from time immemorial. When they had to stimulate the Varmam points in the lower abdominal region of the women, without physically touching them, they used this technique. This could be the reason for the Siddhar to have imparted the Naku Varmam technique. Classification of Varmam points 38. Varmam therapy is one of the unique treatment methods used in Siddha system of medicine, for treating severely injured patients to save from morbidity and mortality condition. Basic concept of information courtesy Dr. K.S. Manika Chelvi. This therapy is stimulating or balancing the energy of particular Varmam points and to regularize the flow of energy. The Varmam points or energized points in human body get injured by various types of pressure or direct hit. Most of the Varmam texts mention that there are 108 Varmam points in human body. Several schools of thoughts classify Varmam points based on various criteria. These classifications are helpful to understand the energy source behind the particular point and to regularize the energy flow in treatment aspect. Classification of Varmam points, 39, 40, 41, 42, 43, 44. Classification based on source of trauma, Udal-Kaya Varmam points. Classification based on regions, Irupatapagudi Varmam points. Classification based on therapeutics. Classification based on Na with Macron Varmam points. Classification based on Adharam, Adhara Varmam points. Classification based on Tridosum, Tritota Varmam points. Classification based on 5 elements, Pankaputa Varmam points. Classification based on numbers, Enikai Varmam points. Classification based on sex, Pal Varmam points. Classification based on source of trauma, Udal-Kaya Varmam points. Udal-Kaya Varmam points are those Varmam points which are classified based on the source of injury. The various sources of injury according to text Varma. Dr. Anavari Anandhan, Varma Thogupu, Indian Medicine and Homeopathy Department, Chennai, 2007. Dr. Kanan Rajaram, Fundamentals of Varma Medicine, A.T.S.V.S. Siddha Medical College, Kanyakumari DT, India, 2007. Dr. Kanan Rajaram, Varma Puligalanai Rupadam, A.T.S.V.S. Siddha Medical College, Kanyakumari DT, India, 2007. S. Chithambara Thanu Pillai, Varma Sucham, Siddha Maguda Pijuram, Chennai, 1910. Dr. Michel Asen, Varuma Vignanam Adipadai Thathavangal, I Part, Siddha Marathova Null Publications, Kanyakumari DT, India, 2012. Dr. T. Mohanaraj, Varma Null Thogathi, 1, A.T.S.V.S. Siddha Medical College, Kanyakumari DT, India, 2010. Otivumuravusari, are as follows, 45, 46, 47. Kalapatadiyadikal patudalalam kadiyanivike kalkalalalam valapakate karidatalam maraning kaipatikal patudalalam melapakake matilan rumamarantukaimantuvazudalam talapapapalam vitatinal kankialakalamatukarantane. Otivumurivakarai. Injury to Varmam points can occur through blunt sources like sticks or by sharp objects or by trauma inflicted through pressure by enemies or falling from a height etc. According to Varma Otivumurivara Sutram, bone fractures will cause the Varmam points injuries. 45. Analulakatil Vajamantarkatai Kaya Muravizutal Talalalam, Varmautivumuravukarakadaram 1200 Yul Kaya Varmam points are of 4 types, 39, 40, 41, 42 and 48. Pajavarmam points, fatal points or injury of Varmam points caused by violent trauma, Tadavarmam points, lethal points or injury of Varmam points caused by touch, pressure and massage. Tata Varmam points, injury of Varmam points caused by stroke or tap. Murivu Varmam points, injury of Varmam points caused by fracture. Utta Varmam points, injury of Varmam points caused by blow. Pajavarmam points. The word padu means to suffer, to increase or to destruct. The injury to this Varmam points will cause tremendous pain, destructs the physical body and affect the functions of particular part of body. The injury to these vital points can be caused by trauma from blunt objects or sharp objects with extraordinary and high velocity force. These injuries can affect the internal organs which are protected by bones and muscles. Each Pajavarmam point will be located or dependent on a particular Na with macron. There are 12 Pajavarmam points listed below. 45 Varma Odivu Murivu Sari 1500, Indian Medicine and Homeopathy Department, Chennai, 1985. Dr. T. Mohanaraj, Varma Odivu Murivu Sari Sudhiram 1500, A.T.S.V.S. Siddha Medical College, Kanyakumari DT, India, 2009. At Dr. T. Mohanaraj, Varma Odivu Murivu Sara Sudhiram 1200 and Sathramani Sudhiram 600, A.T.S.V.S. Siddha Medical College, Kanyakumari DT, India, 2009. For Dr. Kanan Rajaram, Dr. T. Mohanaraj, Varma Maruthavam, Siddha Marathova Null Publications, Kanyakumari DT, India, 2011.